Bruce has gone toe to toe with his general physician regarding blood pressure. And he's not the only one that had this situation happen where he had to have a surgery done on his knee and the surgeons wouldn't do it because his blood pressure, when he went to go get prep for the surgery, they said, oh no, we can't touch you. Your blood pressure is too high. You want to go over that, Bruce, to let everybody know what happened?
Well, that was really the key for me to come to this program because my blood pressure was high. I was on medication, put me on another medication, and then my blood sugar was getting high. My A1C went up a little bit. And so I said, you know what? I'm going to fix it. I lost like 60 pounds. Started getting dizzy. I was on medication. So
taking high blood pressure medication that was shoving his blood pressure down while he was fixing his blood pressure naturally. So now his blood pressure was too low because the drug doesn't know anything better than to push it down. It doesn't care what the number is. It just pushes it down. So that's why Bruce was getting dizzy.
now I'm not taking any.
This is amazing for us to hear because he's not the only one that's gone through this. And I'm going to read a text from another client. He says, Janina, I am mortified. I had been denied for a deep cleaning of my teeth again at the dentist. 4 months and 2 attempts. My blood pressure was 164 over 100. I was so upset. You shouldn't be upset at yourself. He had already gone in for a procedure and been denied. So his emotions to go back to have this procedure done, he's anxious. What do you guys think anxiety does to your blood pressure? Right? Now the doctors have to protect themselves. That makes perfect sense. I'm not knocking the doctor. What I am knocking is the way they're going about testing a blood pressure, and they're not taking into account what is the average blood pressure of that person before they got to the doctor's office. Bruce's situation and with this other client situation, they're anxious because, oh, what if I can't have the surgery because my blood pressure is high again? By the way, Bruce, did you have to drive a few hours to this place for the surgery?
A couple hours away from here. So I had to drive to get the pre-op done, and it was just not conducive to having good reading.
Anxiety again now, thinking, am I going to waste all my time now driving? It's a 4-hour round trip to be denied. This is what we're talking about when you guys have to step up and be your best patient advocate and say, wait a minute, here's what we're going to do next time. And I know this sounds bold to say this to a doctor. You need to tell your doctor, and that is, let me take my blood pressure at home. Let me go ahead and do it 1 week at least, if not 2 weeks, to get some actual readings done at the same time every night before you go to bed, done in the proper way, meaning not having bright lights on or loud music or loud television or everybody hustling and bustling around you. No, in the privacy of your own bedroom, a half hour before you're getting ready to go to bed. You're sitting on your bed, you've got your legs out in front of you, you're sitting up in your bed, you're doing your arm placed equal to your heart. That first reading you get, write it down, leave the cuff on you so it's already set. Take another reading 5 minutes later, and out of those 2 readings, you will see probably a difference. Because what's the first thing that happens when you strap a cuff on somebody? All of a sudden, they're like, they're going to measure my blood pressure. It's already going to go up. And then just the action of putting it on and strapping, you know, the Velcro thing. And how many of you have put the Velcro on wrong and you have to rip it off, right? And it goes, it's just really not the right measurement. So take it with a grain of salt, that first measurement, and just go, okay, whatever it is, write it down. Then the next measurement 5 minutes later, I guarantee you that measurement 5 minutes later is going to be a better measurement. Bill's nodding his head. He knows.
One nurse had called it the white coat syndrome.
Yep. And by the way, they prescribe you medication for that blood pressure based on the white coat syndrome reading. And what do you guys know about me and what I teach you guys? That data is king. But the problem is they're taking the wrong data into play. Then they prescribe you a medication like lisinopril. It just makes no sense. This is where you guys step up to the plate and say, I have medical insurance, and medical insurance, if my blood pressure is high, should cover for you guys to prescribe me a blood pressure cuff, right? And if they don't, then you guys can spend your own. Oh, Bill, what are you saying? No?
I didn't know that.
Oh, okay. Here's the thing that gets me. A lot of doctors don't know it either. Even though you just ask them to do it, like, oh, how about that? They did pay for it. But guess who will tell you? Most pharmacists. You go pick up your medications, you can tell a pharmacist, take another step and go, hey, can you please ask my doctor to prescribe me that? Some of them might. And why? Pharmacist is making a cut off of that. That's their business, right? So why not wouldn't they want to pick up the phone and say, hey, Dr. Jones, your patient Bill here hasn't been prescribed this. Can we go ahead and make it happen? All it takes is, done. And if not, you'll see in the program the ones that I recommend. At the time of the recording, 2023, these are the two options I have for you based on reliability and price point. If you are technologically advanced and you love having data loaded onto your phone, then you might want to do the $74 price point one. But if you don't need all that technology and you just want to get your blood pressure readings, the other is perfect for you. But remember, these only last about 5 years. So if you've had your blood pressure cuff for more than 5 years, it may be time for a new one to have a more accurate reading.
I just wanted to thank you again for your program, because one of the reasons I came into the program also was because of high blood pressure. Doctors have been trying to give me high blood pressure medication for years and years, and I just always refused. But the last 5 days, I've been taking it just like you described, and I have 5 readings here, and it ranges from 126 to 135.
Congratulations, Ron. And by the way, Ron, can you share with everybody how high it was in the past?
It was up there. It was alarming every time, alarmingly high, and they'd always take it multiple times. And then she would always advise me to get medication, and I just refused every time. But your program is working.
If you're a man who is sick and tired of being sick and tired and you want to get off of your medications and reverse disease, plus get rid of belly fat without having to diet or exercise, then click the link below this video. It's my calendar. Yes, you can actually get on the calendar to talk directly with me about your particular situation and have your labs available so that we can take a little dive into your numbers and see where you're at. This way I can talk to you about what your options are. And I look forward to talking to you on the other side.